Let's talk about schizophrenia with leading psychiatrist.
Myself, Dr. M. Gangadhar, consultant psychiatrist, Ganga Neuropsychiatric, Visakhapatnam. Today, I am talking about major disease in psychiatry is schizophrenia. Mostly, May 24th is the day for World Schizophrenia Day. On view of this, a few points regarding the major mental illness schizophrenia. I want to share some points on this topic. And coming to the what is schizophrenia, it is a complete conceptual disorganization of thought. It will be affected in the way of auditory hallucinations and kind of delusions like different kind of hallucinations like auditory hallucinations, olfactory hallucinations like that. Predominantly, the schizophrenia is diagnosed with the prominent features of auditory hallucinations like three or more people discussing among themselves about the patient, and some are having command type of hallucinations that they hear voices of the other people talking in their head, and which are felt by the patient as they are not own. They are voices of other people who are known or unknown people, and they may be completely present throughout the day or maybe intermittent in nature. And mostly patients experiences these type of auditory hallucinations is the main predominant feature to be present to diagnose it as a case of schizophrenia according to International Classification of Diseases ICD-10. And coming to mostly the different types of are there in this schizophrenia. One is paranoid type, another one is catatonic type, undifferentiated type, like that, and epiphrenic type. These are the types of schizophrenia, and these types of schizophrenia are each type has a predominant feature to differentiate it from one type to another, but most probably in prevalence wise, we consider paranoid schizophrenia ranks the first, and mostly the in paranoid schizophrenia, the people have most important is suspiciousness that someone are trying to harm him or following him, or these kind of paranoia features are, and someone are observing him, watching to CC cameras, or poisoning his food. These are the major predominantly complaints will come presented by the attenders to the consultants. And this is the case of paranoid schizophrenia, mostly prevailing in our current scenarios. And the coming to point is whether there are so many social stigmas and myths regarding the treatment aspects of schizophrenia and associated social anxiety futures along in involved in it, and associated depressive symptoms in cases of schizophrenia also be involved in case of this major mental illness like schizophrenia. And how can we tackle this schizophrenia with this futures of any other depressive symptoms or any other anxiety symptoms? And presently, the per se, no need of any prescribing antidepressants or anti-anxiolytics or schizophrenia, because the major illness itself will be subsided with the help of the antipsychotics. After then the symptoms will be resolved. The patient will reach remarkable levels with that duration of treatment. And according to Indian Journal of Psychiatric Guidelines, if the schizophrenia appears for first time, you should use the treatment for up to 2 years. And if the relapse is present during this 2 years treatment, you should continue to use that treatment for 5 years. And if there are more than 2 to 3 relapses present during this treatment, you should use that treatment lifelong based on his remissions and relapses. And with the drug monitoring and with this and blood level monitoring of like RBS, and regularizing his metabolic syndrome side effects. And these are the major predominantly effects during treatment we should tackle it. And also we should rehabilitate the patient with providing better coping skills and educating the family members to reduce their expectations, and keeping the patient suitable occupational setups also very important step in keeping the patient nearer to the society and in the society. And along with using medication, the patient should be tackle these symptoms, and which are mostly drag out the patient from his negative symptoms like these depressive symptoms or anxiety symptoms, which are mostly helpful by our non-pharmacological management. And the pharmacological management mainly tackles with this suspiciousness and hallucinations and any other aspects of spectrum of psychotic related issues developed by dopamine. And this is about schizophrenia. And if any person suffering with like talking to self, talking to self, because of he's hearing voices and he is answering to the questions, to the voices he is hearing in his head. Because if you observe any case like this, just bring out to the concerned doctor, nearer to the concerned doctor, psychiatrist, and take adequate treatment. And as duration of untreated psychosis is less, the outcome of the patient and the prognosis of the patient and the quality of life of the patient will be very good. And cognitive deficits like attention, concentration, and the social interaction, and other cortical functions will also be maintained if the treatment is started as early as possible and the duration of psychosis is reduced. The outcome of the patient will be very, very good. Hence, early intervention and early detection and early prevention of the case schizophrenia is very important. And other aspects in schizophrenia are variants are in some kind of acute and transient psychotic disorders are present, and two disorders are also will be present, and with comorbid affective symptoms like maniac symptoms like excessive talking, like that comorbidly present along with this paranoia symptoms. And we should differentiate and add according to the mood stabilizer or anything else in it. And according to ICD-10, these symptoms should be present for at least 1 month continuously for diagnosing a case of schizophrenia. And if the patient is suffering continuously with these symptoms for a period of 1 month, should be taken to a psychiatrist and should be taken treatment according to Indian Journal of Psychiatric Guidelines. There's a particular guideline. No need to use every patient to tell that a lifelong medication should be used. Because with this, if the improvement is present with early intervention, the stigmas in India also will be reduced with this effective early intervention management of these cases of schizophrenia. And the prevalence of schizophrenia in India is also rising adequately in rural areas. Hence, we should educate it as early as possible as it a major mental illness, and we should eradicate this disease. Okay.